Good afternoon, and welcome to the Assessing Community-Based Services through 1915I webinar. Before we get started, here are a few reminders about the webinar technology. Please make sure you are using a computer or smartphone connected to the internet and the audio function is on and the volume is turned up. Please be sure your microphone is muted for the duration of the call, unless you are speaking or asking questions. Questions can be submitted at any time during the presentation using the Q&A feature located on your control panel. We will answer as many questions as time allows after the presentation. American Sign Language interpreters and closed captioning options are available for today's event. The American Sign Language interpreters for today are Danette Steelman Bridges and Susan King Lanier. For closed captioning options, select the closed caption feature located on your dashboard. To adjust your video layout and screen view, select the view feature located in the top right-hand corner of your screen and choose the video view that works best for you. Today's agenda topics include introductions, MHSU IDD TBI system updates, and then a presentation on how to access community-based services through 1915I. There will also be time for questions after the presentation. At this time, I would like to turn it over to Kelly Crosby, Director of the Division of Mental Health, Developmental Disabilities, and Substance Use Services.
Thank you very much, Dina. Hello, everyone, and welcome to our webinar today. My name is Kelly Crosby, and I am the director here at our Division of Mental Health, Developmental Disabilities, and Substance Use Services. I've met many of you, but we had such an incredibly large turnout for today. There could very well be lots of folks on the call today that have never met me before. So just to let you know, in addition to my title, I've been in this field, mental health, substance use, IDD, and TBI field for about 30 years, a really long time. I've had the privilege of being at the state for almost 14 years now. And I am a person with lived experience. So this is really, really important to me. I've got lots of family members with mental health and substance use issues. And I've also got family members with intellectual and developmental disabilities. So I'm proud of that lived experience. And I know many of you here today on the call are a person with lived experience, a person who uses services and supports, or a provider that supports people with intellectual and developmental disabilities. So thank you all for coming today. I'm taking a little more time than I normally would to introduce myself, partly because we have such a large attendance roster for today. We had over 1,200 people sign up. And I want to make sure that I spend a little time saying hello at the beginning to allow time for all people to get here before we get into the meat of the presentation. So I'm going to introduce my co-presenter, but actually the expert who's really going to be walking through everything today, Ginger Yarborough. So hopefully most of you know Ginger Yarborough. I've had the privilege of knowing Ginger. Yeah, I was going to say it's got to be more than a year now, but Ginger has been in our system for a very long time. Many of you know her. She was a direct support professional. She worked at different provider agencies. She worked at state agencies. She's an expert in the field of intellectual and developmental disabilities. She is our director here at DMH DDSUS for our IDD, traumatic brain injury, and Olmstead programs. So really, really important stuff. And Ginger's also really good at data and has a lot of quality improvement expertise. So very, very excited. But that also means part of what Ginger is always pushing for us is to do the best job we can and to use data to improve everything that we're doing. So I'm very delighted that she is here leading this really important work at our division. Now, what I'm going to do first, as people are joining, the number keeps ticking up and people keep joining. I'm going to give you some quick system announcements. We want to take this opportunity to let you know some things that are happening in the system before we get into the heart of today's presentation. So the first announcement I want to give you is just to remind folks that we try really hard to connect with you. We want to connect with you. This is a public system. We're all participants. We need your perspective on how the public mental health, substance use, IDD, and TBI system is working, what we need to change, how we need to spend our money, what our policies need to look like. So to that end, we have a very intentional collaboration model. Every month, We host a side-by-side webinar. Many of you do attend that, which is really cool. We also have lots of groups we meet very routinely and purposefully with. And at the bottom, we have that gray box. We have 5 groups dedicated to helping us make the wisest choices we can about funding we received from the General Assembly recently. But there's a link. The most important thing I want you to think about is your engagement is incredibly important to us. Side by Side is a webinar we hold every single month to talk about what's happening in our system. And there's a hot link in these slides, which you'll get after the presentation. So you can join our listserv, so you can get invitations to Side by Side. You can fill out a form to get invited to any of our advisory groups. All are welcome. All are welcome. All right, next slide, please. Another very important announcement to us, right? On July the 1st, so just a few days ago, a week ago, we had our side-by-side meeting for July. We invited the CEOs of Tailored Plans, and because it was the launch of Tailored Plans. So very exciting. We had all the CEOs on. We got to ask them some questions. It was really cool. So Tailored Plans have been live now for 8 days, okay? In advance of Tailored Plan launch, we worked really hard with our Consumer and Family Advisory Council and with other consumers and families across the state to create some materials so people could understand the transition hopefully a little bit better. We call it our Accessible Communications Campaign. I think healthcare is confusing. It is. Public system and rules and regulations are confusing. My family members reach out to me to ask about healthcare, even if we don't live in the same state, because I'm in it. So I understand it a little bit better, but I know it can be pretty confusing. Tailored Plan is a big change for a lot of people. It's changing the way they receive Medicaid services. And we got some really clear feedback from consumers and families across the state that we need to do everything we could to make the changes clearer and more understandable for people in our system. That's important. We take that really, really seriously because we want people to understand their Medicaid. We want them to understand the public mental health, substance use, IDD, and TBI system. And we want folks to get whatever benefits and services, advocate for themselves, get what you need to have the best life you can have in your community. That's what we want for everyone. That's why we're doing this webinar today. We want people to know about this benefit that's called 1959, how you get it, and what it could mean to your life. So again, in anticipation or prior to Tailored Plan launch, we started working on our Accessible Communications Campaign. We've already released 2 versions of it now, and that's everything from social media posts to PowerPoint presentations to one-pagers that you can share that help explain a little bit about that new Medicaid plan and what it's like. And we released some things very recently, a few weeks ago, that also talked about non-emergency medical transportation, so how you can get transportation to go to your appointments. We released a one-pager on 1915I option services, and we're working on new things now on tailored care management and other important benefits. So as we hear from you about other things you need to understand or things you want to know about your health plan and about our system, let us know. If you go on the next slide, I believe there is a QR code. There is. Tell us about the accessible communication, how it's working, what you want us to tweak, and what's missing. What should we work on next? I promise you, as part of the Accessible Communication Campaign, we're doing more to spread the word about the 1915I option. So this webinar is one of the things that we're doing. We'll be doing more webinars. We'll have more toolkits that folks can use and download because we want folks to understand this benefit. That's what it's for. It's for people to use it. So we're very excited about it. Okay, so feel free to scan the QR code and send us feedback. I've got a couple more announcements before I turn things over to Ginger. I want to remind folks about 988. Hopefully everyone knows 988. Hopefully everyone is seeing signs on your streets and your grocery stores. Some of us went to the movies this weekend and we saw a commercial for 988 right there at the movies. And it was actually one of our actual call center operators at 988. 988 is our crisis and suicide hotline in North Carolina. We publish a dashboard every month. This is the dashboard that you're seeing because we want everyone to know who is calling, what parts of the state they're calling from, what their needs are. We use this data every day to make better informed decisions. But we also want people to know that the lifeline is there for anyone that wants to call. You don't have to be in crisis to call. You can call when you need some advice, when you need someone to talk to, When you want to figure out how to find services, there are so many reasons you can call that line. So feel free to call that line. We are about up to our 2nd anniversary. So you'll be seeing us doing press releases and a visit to the call center because we're super, super excited about 988. We welcome your feedback on how it's working and how we can make it better. Next slide, please. Also want to alert you to another webinar that we'll be doing in a couple of weeks. So this month is Minority Mental Health Awareness Month, and we're doing a webinar here on transgenerational trauma. So we invite you to come. We've got some experts, we've got some staff here, and we welcome you to come to this really important webinar. Next slide. So in 1 second, I'm going to turn this over to Ginger. And as Ginger and I were kind of talking a little bit beforehand, I had a realization. I realized that, we tried to be very thorough in explaining what 1915 is. Just wait, Ginger will explain. It's very jargony, isn't it? It's a very governmental thing, 1915. But one of the most basic things we didn't have a slide to explain is what the heck a community-based service is. You've probably heard the term home and community-based services, HCBS. 90% of people on this call might be like, Kelly, I know what that is. Maybe 10% know what it is. It doesn't matter. I want everybody to know when we use that term, home and community-based service, what it is and why it matters. Home and community-based services are the kind of services that people can get that help them live more independently in their homes, their own homes, and in their communities. So the services that Ginger are going to tell you about are services that allow people with intellectual and developmental disabilities to go out in their community, to go shopping, to get a job in an inclusive environment, to go to church, to meet with friends, to help them manage in an independent apartment, to get some respite, a break from maybe their family or caregivers. So these are really important services. We want people to know about them because, again, the whole point of them is these are services to help people with intellectual and developmental disabilities. And you'll see people also with traumatic brain injury and serious mental illness. We'll also talk about those today. Folks get the support they need from a professional to be as integrated in the community in whatever ways they want to be. So that's why they're called home and community-based services. They're services that help people get out and about and live more independently at home and in the community of their choosing. So they're just really important. So when we say things like community-based services or HCBS services, that's what we're talking about. But Ginger's going to break down the rest for you. And then we're going to leave time at the end to answer questions. You can put questions in the Q&A, as Dina mentioned, and we will sort through those at the end. Now, please know, because there's so many people on the call today, we might not be able to get to all the questions. And the questions may prompt us to say, oh boy, we need another webinar to talk about these things that came up a lot. So please know that we care. With Ginger's QI mindset, her quality improvement mindset, we're going to listen to the comments, we're going to listen to the questions, and we're going to do whatever we need to do to follow up. Because again, our goal, anyone ask you what the point of this webinar is, our goal is that everybody who listens in today, and you can tell your friends and families too, knows what these benefits are, knows what a home and community-based service is, knows what is available to you if you have Medicaid, and know how to get it. That's our goal. We want folks to get these services so they are living the lives they want in their home and community. So that's the whole point of today. So send in your questions. We'll get to what we can, and we'll follow up on the rest. So without further ado, I'm turning this over to the expert, Ginger Yarborough.
All right, thank you, Kelly. Good afternoon, everyone. Like Kelly said, I am the Director of Intellectual and Developmental Disabilities, Traumatic Brain Injuries, and Olmstead Programs here at DMH DDSUS. And I am really excited to talk through what the heck 1915I services are and how to access them. Next slide. So 1915I is a fancy term for the avenue to home and community-based services, which Kelly just described. And these are free services and are designed to help people, including members and caregivers, get the support they need to live where they want to live. When we talk about members in this presentation, we are talking about individuals with a disability who have Medicaid. And when we talk about caregivers, we mean those people in a person's life who are not paid, but provide care and support to the member. To be eligible for these services, you must have an approved 1915I assessment. Don't worry, we're going to go over that and how that process works in just a few minutes, and be diagnosed with a serious mental illness, SMI, severe substance use disorder, SUD, a traumatic brain injury or TBI, or an intellectual or developmental disability, an IDD. And just for note, many people have co-occurring diagnoses within these categories as well.
So Ginger, I promised I wouldn't interrupt you, but I am.
Yes,
I
ma'am.
did, I promised her I wouldn't. So this is a Medicaid benefit, Ginger. If you have Medicaid, you might be eligible for it.
Yes,
Do you need an innovations waiver slot to get these services?
absolutely not. You do
Absolutely
have to
not.
have
You'll
it.
hear that. You do not need a waiver slot. You can be on the wait list and get these services if you have Medicaid and meet the requirements. Okay, I will try to go back to not interrupting you, Ginger. I'm just excited about that. I'm excited about it.
Next slide, we'll go over what services are available through 1959. So here you're going to see, and I'm going to try to explain the acronyms because I get caught up in the jargon as well as we go through these. So community living and supports is CLS, supported employment, which is SE, individual placement and support services. You'll hear it referred to as IPS, respite care, individual and transitional support, and community transition. I want to stress for you that for those of you who are on the innovations waitlist, receiving these services does not impact your waitlist position at all. So if you're receiving community living and support services through 1915I, you're not going to be taken off the waitlist. You were going to keep your spot. To find out more about which of these services you might be eligible for, contact your tailored care manager. If you do not have a tailored care manager or don't know who that is, contact your managed care organization. And we've got numbers listed down here in the slide. Next slide. So this slide is a little bit overwhelming to look at, but I wanted to include it to show just how not all services are available to everyone with Medicaid. So this handy dandy chart specifies which service is specific to which diagnoses and age groups that determine eligibility. And this is also going to be included when we go through each of these individual services. So this is just kind of a cheat sheet for those who want to go back and look at it. Next slide. There is one other thing to mention before we start doing some deeper dives. There are some limitations that we want to talk about to the services here before we get into the nitty gritty. So supported employment and community living and supports are limited to 40 hours a week in total. So let's say you have 25 hours of community living and support, then your supported employment can't go over 15 hours a week. And those hours can be divided however it works best for you. If you're still in school or under 22 years old, community living and supports is limited to 15 hours a week for those school weeks and 28 hours a week when you are on break or tracked out, and that might be summer or winter break or any other type of track out for those that are year round. If you have completed school and received your degree or a GED or a certificate of completion, then you are eligible for that 40 hours combination of CLS and SE. Individual placement and support or IPS, you can only have one provider at a time during an authorization period. And this second part is more for the providers. This service is only billable for direct employment services and supports. So just wanted to clarify those things. All right. Another important notice, those of you who are receiving 1915B3 services, there's a lot of discussion about how people are transitioning and when they need to transition to I services. So just wanted to include this slide here. Many people have already made this transition, but there are some folks that are still in process. Your process to transition from B3 to I is going to look very similar to the process we described later in the presentation. Your care manager will contact you to do the 1915I assessment and will ensure your plan is updated to allow your services to continue. One big thing that you can see here in red, you should not have any lapse in services as you transition to the I services. Next slide. All right, so now we're going to get into a little bit more of the nitty-gritty around the individual services. So the first one I want to talk about is community living and supports. So community living and supports, a big goal of this service is teaching and promoting independence. So teaching people the skills that they need to live in their home and work in or participate in community activities, build their community around them. There's also some elements of personal care. So an example of how this might look in action is a person might need support through the meal planning process. So providing prompts or support through choosing the meal to provide, determining, do we have the ingredients? Do we need to go grocery shopping for those things? And providing some structure and prompts to do that task. Another example may be including supporting someone through bathing and dressing for the day. It's very individualized and really geared towards learning skills to attain the goals that the person has. This service is specific to people with IDD or TBI, 3 and up. Next slide. So supported employment, this is probably one of my favorite things to talk about. Supported employment is for people with IDD or TBI to go through the entire employment process. So determining what kind of job a person wants, building the skills and resume to acquire the job, on-the-job training, and support navigating the work environment. This service can also be used to help a person figure out how they're going to get to and from work if they don't already drive. I want to emphasize that you do not have to have a job or even know what kind of job you want in order to access supported employment. You simply have to be interested in working in a competitive integrated environment. So supported employment might look like someone is attending a day program and they have decided that they want to explore employment. So they start working with a supported employment coach and working through, well, why do you want to work? What do you want to do? What are the things you're interested in? What are you good at? And then developing their resume and any skills to acquire that job. Supported employment can be on the job with you as long as you feel like you need that level of support. And again, this one is available to people 16 or older with IDD or traumatic brain injury. The next slide is IPS, or individual placement and supports. This one's very similar to supported employment for people with IDD or TBI. IPS is just geared towards individuals with severe and persistent mental illness, or SPMI, serious mental illness, serious emotional disturbance, or substance use disorders. And again, this is for 16 and up. Again, you do not have to know what kind of job you want or even have a job. It is all about, if you want a job, this service is here to help you. And they can help you, again, determine what kind of job you want, build the skills in the resume to land that job. They can accompany a person through the job training process, through the hiring process, and navigating the work environment, because we all know that can be kind of tricky as you are getting working. Next slide. All right. Respite care is a little bit of a different service. So the previous services we talked about were about teaching and learning and creating independence at home, and at work and anywhere else you want to go, right? Respite is geared a little bit towards caregivers. So caregivers, again, in this instance, these are the people in your life that support you and are not paid to do so. A lot of times this is parents, grandparents, friends, or relatives who you may live with. Respite also provides a great deal of support for the person receiving services, because sometimes we all need a break from those that we live with. So respite care services provide for those supports to take a break, with your caregivers knowing that you are in capable hands. They know that this person is trained in your needs. They know how to support you through anything that you may need while they're gone. Respite can be provided overnight. It could be done on the weekends, during the weekdays, or in an emergency. And it can be done at your home or somewhere else. So out in the community, for example. Respite is for children 3 to 20 with serious emotional disturbance or substance use disorder. And it's also available for people 3 and up with IDD or TBI. Next slide. All right. Individual and transitional support. So this is a service for people with SUD over the age of 16, SMI or SPMI over 18 years old. And for those with SED, ages 16 to 21 years old. This is where that chart really comes in handy because there are these little nuances for each of these services. So this service can support recovery planning from mental health issues or substance use and can help throughout the recovery process. Helping someone find access to transportation if they don't drive, finding a place to live, helping someone figure out how to manage their funds, how to manage their money, or finding continuing education if you choose to go that path. So this is a kind of an all-around service there as well. And then finally, next slide, please. Community transition. Community transition is unique in that it provides up to $5,000 to help people move out of an approved setting. And an approved setting can be a setting like a psychiatric residential treatment facility or a PRTF. An approved setting might be a foster home or a community intermediate care facility, or I'm sorry, intermediate care facility, ICF, into a home of their own. People eligible for this service are people with IDD, TBI, substance use disorders, SUD, SMI, and SPMI. They're all available or all eligible to receive transition funds. And these funds can be used to furnish your home, pay for setting up power or phone services, getting those essentials that you need in your home, like bedding, or your kitchen setup, like pots and pans, or a number of other things that you need when you're moving into your first place. We all know that can be pretty expensive and pretty overwhelming. And you're already on this one. All right, so we've gone through the different services, but you're probably wondering, how do you go about actually accessing those services or getting those services started? So with this slide, I'm going to walk you through that process from the member's point of view. So first, call your care manager, your tailored care manager. If you don't know who your care manager is, you can call your tailored plan and they can help connect you. So your care manager is then going to complete a 1915I assessment. I want to stress this is not a long process. It's not a long form that has to be filled out, but the assessment helps to understand what services may be right for you. And it helps to develop the or update your care plan later. You may hear the care plan called a person-centered plan or a PCP, an individualized support plan or an ISP or a care plan. Those terms are a little bit used interchangeably. So when you hear me go back and forth between those, they all refer to pretty much the same document. A care plan and ISP both incorporate the results of the comprehensive assessment and identify the desired outcomes and what is needed to achieve those outcomes. The third step, determining eligibility. So the care manager submits the 1915I assessment to the vendor to determine eligibility. That will then get returned, and if found eligible, that's when you're doing the plan development. So the care plan or the ISP will be developed or updated to reflect your goals and services. So if you already have one in place, it'll just get updated. If you've never had a care plan in place, a new one will be developed. This is also when you're going to start looking for a provider agency. The provider agency is the company that employs the one-on-one staff to provide those services. If you already have a provider agency, you can choose to keep that provider and keep working with them if they provide the services that you are requesting, or you can choose a new provider. So once the plan is completed and you've signed it and you have an identified provider, your care manager will submit the plan to be reviewed. And once it's approved, your provider can start services. Once services start, your care manager is going to stay involved with you and to ensure the services are being provided as the plan describes and coordinate your ongoing care. They're also involved so that if something changes, you can update your plan and update services or change providers if need be. Next, we're going to go through a couple of scenarios. So this first one, we're going to talk about Paula. Paula lives at home with her mom, Jackie, and she also has a traumatic brain injury. And while Paula can do a lot of things on her own, Jackie still does all of the meal prep, the cleanup, and takes care of all of the bills. But Paula really wants to live on her own after she graduates high school. Paula has a care manager, but doesn't currently have any services. So the first thing Paula's going to do is reach out to her care manager. The care manager is then going to complete the 1915I assessment to determine the to submit for eligibility. Once found eligible, Paula's TCM or care manager is going to help develop an ISP with Paula and Jackie if Paula chooses to include her. That includes Paula's goals, which probably include how to cook, how to clean up after herself, and manage her own finances. This plan is then submitted and approved. At that point, Paula starts receiving services. She has a staff person who comes to her home 3 days a week to help her learn how to organize herself and her space. And Paula starts to become more independent in these areas. So cooking, cleaning, laundry, and starts managing her own expenses. This is a big step towards living on her own. And by the time Paula graduates, she's starting to stay overnight by herself and is ready to start looking for an apartment with 1915I's services to continue as a support in her own space. So you'll see how it went from she was ready to gain these skills to how it supported her overall goals. I think you've already gone to the next one. So the ambitious worker. So in this scenario, we meet Alexia. She has schizoaffective disorder, and she is currently receiving 1915I services. Alexia has voiced that she would like to find a job so that she has some money so she can go hang out with her friends more often. She went through the Division of Employment and Independence for People with Disabilities, or EIPD, formerly known as vocational rehab. Alexia tells her care manager that she wants a job. Her care manager then helps Alexia find an IPS provider, so an individual placement and supports provider. And they talk through what her goals are, what kind of job she's looking for, and updates the plan to reflect those employment goals. Alexia then starts to receive IPS. She starts exploring jobs. She works with her job coach to update her resume and lands a job as a runner at her local television station. Alexia's employment specialist continues with Alexia through the hiring and training process, and the employment specialist can continue to support Alexia as long as Alexia needs the support. All right. Next slide. Finally, now that we've gone through all of the services, how to get there, and a couple of scenarios, I would be remiss if I did not share this slide. We have our monthly side-by-sides with Kelly, as Kelly talked about earlier. This first QR code is how to register for those. The second QR code is how to join one of our advisory committees. Again, we need all voices at the table so that the system works for everyone. So please join us. And finally, the third QR code is to join the DMH-DD-SUS mailing list. Tons of exciting information comes out through that mailing list. So again, I encourage everyone to sign up there. And with that, I believe I'm handing it over. I think you muted everybody.
Good afternoon, everyone. We're going to turn it over to the Q&A portion of today's call. Thank you, Kelly and Ginger. We've had a lot of questions coming in Let's just make sure folks can unmute themselves.
Hey, Katie, I think I could. So can I, as you're looking at that, I just want to do a quick acknowledgement. At first, I want to,
Please.
and I'm sorry for not doing that up front. I really want to extend a big thank you to all our colleagues at Medicaid. So DHB, Division of Health Benefits, they're all on here. They've all been working so hard on this. They're the best partner, and they'll be helping answer questions too. And they've been answering questions in the chat. So thank you so much, our LaCosta and David and Greg and all the Medicaid team for being here today. The other thing I'll just say is that there are some really awesome questions coming through. And what this is really helpful for us. So please, we're going to do our best to answer what we can. Please know that this says to us, these are common questions, and this will help us either do another webinar or incorporate these, pretty really good questions that we're seeing with some frequency in the chat into things like FAQ documents, so frequently asked questions documents. So thank you so much for all the questions coming in. And Katie, without further ado, I'll hand it back over to you.
Excellent. All right. Like Kelly said, we've had many really great questions. We want to start off with a couple of them here for the group today. The Q&A panel is open, so feel free to keep dropping your questions in there, and we'll try to get to as many as we can. So the one question we want to start with a couple people wanted some insight on was, what does it look like for the intersection of the waiver and the 1915I services and the innovations waiver waitlist? So I would love a representative from DHB just to share a little bit more information about that. I think we should have several folks, if you're able to come off and
Hey, Katie, this is Greg. Just could you kind of go back and give us a rundown of that question again? Because I know we have LaCosta that's on. Maybe LaCosta, you just chimed in. You want to go ahead and say something?
I am. I'm sorry, I couldn't get off mute. My mic was working. I need to replace my batteries.
Okay.
So with that, I think it's important, and good afternoon, everyone. I think it's important to understand when we talk about the intersection of both. For this particular service for 1915I, you can be on the wait list and receive 1915I. We are currently talking internally. We're planning to talk with the Taylor Cure managers around how reaching out to individuals, not only the Taylor Care managers, but the Taylor plans, around reaching out to individuals on the wait list to ensure that those 1915I assessments will be completed for individuals on the wait list. When it comes to the innovations waiver, I believe that was the question, right, Katie? So for these services are basically services that what we say mirror the innovations wait list. And so when you look at it that way, we took the most used service, we looked at that and said, what are the most used services here from the innovations waiver? It is particularly when you talk about the IDD population, it is community living and supports, supported employment, respite. When you look at that, we wanted that available in what we call the state plan, the SPA 1915I, all of the jargon Ginger and Kelly mentioned earlier. And so therefore making these services available for individuals who are not on the waiver yet or don't have a waiver slot, also that they are able to get these services outside of the waiver. So keeping that in mind, it was determined that since these are look-alike services, the individuals on the waiver, their needs are met because they have these services that look like, that are in the eye and more that are available in the waiver. So I hope that answers the question, Katie, as far as the intersection of that. But what I can say, Ginger, if it's okay, you and Tina, I think there's more to come on that reach out of the individuals on the wait list and what that's going to look like, and ensuring that those individuals who are eligible access eye services.
Thank you so much, LaCosta. I appreciate that really thorough response. All right, another question we have come in is, does the 1915I only include IDD and TBI services? Are mental health services included? Would DHB be able to clarify?
Yes, so I will answer. We do have Stephanie Wilson on the call, who is our policy consultant for one of our mental health policy consultants for the adult population. But yes, mental health services are available under the eye.
Thank you for that. Stephanie, is there any information on that you'd like to add or share?
The services, supported employment, individual placement and support, IPS, is a service that's available for people with mental health diagnosis. Community transition is a service that's available for people with a mental health diagnosis. So yes, there are services included.
Exactly. And I just want to also say that you can use respite as well.
Thank you, Phil. We had a couple of questions come in for helping to understand what is community living and supports. What does that mean? What does it look like? What comes with it? Would we be able to have someone share a little bit more information about that?
I'll
So,
take a step.
okay,
Go
I was
ahead,
gonna
go
say,
ahead.
well, go ahead, Kelly. Yeah.
Oh, no, you go. LaCosta, you go.
That was good. And Greg, if you want to jump in, I think Kelly framed it so well at the beginning. Community living and supports are really it is a service that supports the individual to live the life that they want to live in their community. It looks at their needs as far as skills that they may need to learn, but it's also the integration into the community, getting them into their community, not just any community, their community, what's available in the community that they live in. So that process really starts, Katie, and to the individual that asked the question, it really starts with the sit down with the Taylor Care manager to look at, hey, what do I want my life to look like? If I qualify for these services, what goals do I want to reach? As I live in my home, as I live in my community, as I access the things in my community, the different resources in my community. So it really is, one, about the person. It is about their needs, and it is about their identified needs and the what I call the ecosystem, that support system, that circle that's around them. That circle that's around them is there to support them in accessing and achieving their goals. So I don't really like to put limits on it as what you can do, because it depends on the person. It depends on what their identified need is. So it's really difficult to say it's this or it's that, because sometimes when you do that, people look at it and say, well, that's all I can do. But it's not all you can do. It is very person specific. And for those who are on the call that are not quite familiar with Innovations Waiver and kind of our whole system, there's that person-centered planning process that goes with it. And so that is a part of this process as well. Person is centered on the person, and it's the planning for the person. Okay.
I think you summarized that very well, LaCosta. I just want to add to everyone out here today that please go on to our website and look at our clinical coverage policies that they're all 8H1 to 8H6, and community living and supports will be 8H5. So if you need to know what that is, we can put that in the chat so you can access it. But that's very important. It'll tell you definitely where to go and how you can access the definitions for that service definition.
Thank you all. Appreciate that. We had a follow-up question come through on asking if guardians are allowed to provide community living and supports. Would Racine be able to share a little more information on that?
Hi, yes, Katie. We speak to that in the policy, which Greg just mentioned for CLS, Community Living and Support. So for individuals, relatives who live in the same primary residence as that beneficiary, if that member is under 18 years of old, the relative is not able to provide that service. But if the member is over 18 years of age and older, the relative could provide the service for community living and support.
Thank you for that information. I appreciate it. All right, another question we had come through, a couple of questions about this, is really asking about living arrangements for people who are receiving 1915I services. Can an individual live in provider-owned housing and receive these services in that setting? Would love to have someone share some information on that.
That question is probably going to be dependent on the services. For example, the IPS service, an individual could be living in provider-owned housing and be able to receive assistance with employment under IPS. Community transition, because that's a service that's all about you transitioning from an institution into your own home, apartment, or living arrangement. Of course, you would not be able to transition into a provider-owned residence in order to get that service. So it's going to be dependent on the service.
Thank you so much, Stephanie. Christine, were you going to add something? I'm sorry.
No.
So sometimes yes and sometimes no. But what we're hearing again, so many of these are takeaways like we need on our FAQ or on our one pagers, can families provide this service? Yes, this one, not this one. You have to be over 18 or under 18, and also what living arrangements can people live in for what services? So these are, I think, really helpful for us to clarify for everyone. Super good question.
Thank you all. We'll continue trying to get through as many as we can. We've had another question come through on the difference between transition services and targeted case management. We hear those terms quite a bit. Would LaCosta or another person on your team be able to talk a little bit about what that difference is, if there is one?
Did you say targeted case management, or are they saying tailored?
The question
Let's
is
assume
asking-
tailored. Let's assume
Okay,
tailored.
let's assume tailored, because
Yep.
all right.
Yep.
So, and community transition. So community transition is a service. And the tailored care manager can support you in accessing the community, the service community transition. And that service is centered around assisting individuals who are moving out into the community, into their own home. So it's kind of a cost, the overarching cost, I think it's $5,000. Racine and
That's correct. It's
$5,000.
$5,000.
$5,000 to help you move into your own space, into your own apartment, however you deem it. So that service kind of intersects with the tailored care manager, in that the tailored care manager supports the individual in accessing the service and also planning the goals, the community transition goals, what the person will need.
Thank you, LaCosta. Thank you for clarifying that. Appreciate it. All right, another question for folks are having is, how would they apply for the 1915I? Is the only way to access 1915I going through the assigned care manager?
Well, no, but we would like for you to secure it through email, which is North Carolina Medicaid 1915I request@careline.com. However, if you intend to submit directly to Careline, please inform the Taylor plan that you're involved in your catchment area. They want to know that you're doing this for record purposes, to track the record, to see what is actually going on. So those are the ways that you can access that information over for the 1915I assessment.
What
Thank you,
I'm
Gregory.
hearing, just to clarify, in case there was a problem hearing that, because I saw there were a couple people asked in the questions, like I declined care management, which people can't. You can decline care management. So I just heard very clearly that we need to publicize the way that people who have decided not to get care management, which is totally fine, can also access 1959 services. So thank you so much for sharing that resource. We need to make sure people are well aware of that resource.
Thank you both. As sort of a follow-up question to that, what does it look like in terms of length for eligibility determination? Do we have thoughts on that or insight
on the
into the
average-
assessment?
On the average for eligibility determination, it usually takes anywhere from 7 to 10 days. If you're looking at the initial intake from when this started, about a year ago, we had assessments that were backlogged that were coming in for June, July, and August. So that took a considerable amount of time as we tried to stand up the 1959 services. So going forward, we're looking at 7 to 10 days to have that turnaround right now presently. And we're hoping, as we continue to work along with the 1959 assessments of eligibility determination, that will increase to maybe within 5 days. That's forthcoming.
Thank you. That's great to hear. We've had a question come in about eligibility, and I think this was answered earlier, but it sounds really important. So I want to raise it up again to make sure we all have the information. And the question was asking if a child isn't eligible for Medicaid, could they still receive 1915I services?
If they're not eligible for Medicaid, could they receive 1915I services? No, they have to be eligible for Medicaid in order to receive 1915I services.
Thanks, Gregory. Appreciate it.
Now, I will say, because the question came up too about state funded services, because again, not everyone is eligible for state funded services. And it can be hard for those of you that do have other insurance, right? That's not Medicaid, to get other insurance to cover these kind of home community-based services. So I would say there is limited state dollars because it is a finite amount of money. It's not Medicaid, it's not an entitlement, but LMEs, your tailored plans, they do get some state dollars to pay for some of these services as well. But again, when the money runs out, it runs out. But there are, for people that do have, who don't qualify for Medicaid, there's a possibility that you could get some of these services through the LME with state dollars. And in that case, you know, if it's deemed you're not eligible for Medicaid and therefore not the service, you can talk directly with the LME, Alliance, Trillium, Via, or partners, and ask them about the ability to get some services through state dollars. And sometimes providers know too. So if you happen to be already connected with a provider, they might be able to help you with that too.
Thank you, Kelly. Appreciate that. One of the questions that came through was, how do we find providers for services? How would families and folks get connected with services?
That is a big part of what your care manager does. I'm going to say that, you know, being a care manager, right? I was a care manager for a long time, right? So your care manager can help you, again, when they do an assessment and they talk with you about your goals and they help you do a person-centered plan. Part of what we want them to do is let you know these services exist. And so we want them to tell you about them and they can help you. All that, you saw that slide that Ginger had with all the circles about the assessments and everything needs to do. So much of that's what the care manager does, right? They help get the eligibility determination. They send the request into the LME. They help you update your plan. They can help you find providers to choose from, right? So that's a good role for the care manager. You can also ask your LME, the person providing the tailored plan, because they've got networks of providers as well. So sometimes just calling the LME or looking at their website to find providers. So you can call and ask around and get your feel for the provider or test them out. You can do that too. You can just go to the LME's website, call the LME. They can tell you about choices you have of providers. And sometimes you can go to their website if you're more comfortable with that and search around on their website for providers. So there's different ways to find out who providers are.
Absolutely. I want to piggyback off what Kelly just mentioned. You can definitely go to your tailored plan, and those are the four that she mentioned earlier: Alliance, Partners, Via, and Trillium. To get that information, they should have a list of providers that they contract with. So that's something that you can utilize as a reserve to find out where the provider's at.
Excellent. A lot of good information here. We've had several questions. It's always a question we get about if we'll be sharing slides and the information after. Yes, we're recording today. We'll make sure everyone gets the recording as well as a copy of the slides, and we'll be posting those to our website as well. Okay, we have a couple more minutes, so we're going to try to get through a couple more questions as we can. We know this is really important. We've got a question here in terms about our respite services for people with 1915I. Can DHP talk a little bit about what that looks like?
If I'm hearing the question correctly, Katie, you are able to get respite services under I. Let me just say that. You complete your 1915I eligibility assessment or 1915I assessment, and then your plan is developed. If respite is a service that you need and you're requesting, then of course it's reviewed and approved through the tailored plan. But it is a service that is there, and I think there was a question around the amount. Respite is currently set at under the I at 300 hours. Greg, did I hear you come on.
No, you're correct. That's definitely right. I'm sorry. I should have been on mute. Go ahead, LaCosta.
No, that
Rock
was it.
star in progress.
I hope I covered what the person's question was, but it is available.
I think so, LaCosta. Thank you. All right, a next question. For people with mental health and substance use, is it necessary for them to be approved for 1915I services to obtain a comprehensive clinical assessment in order to be able to proceed with approval for their 1915I services?
Hi, it's me, it's Stephanie. No, they don't need to be approved for 1915I services in order to get a clinical assessment. CCAs are not a part of 1915I. What they need is to have the 1915I assessment. That's what they need to determine if they're able to get a 1915I service.
Thank you, Stephanie. We've had a couple, Gregory, if you don't mind, we'll make sure folks get it. The link that you mentioned earlier, we want to make sure we get that in the chat for folks to be able to access that.
Sure will. Give me a moment.
Thank you. Appreciate that.
Plug that in. Mhm.
Thank you. Okay, I think we have about time for maybe one more
Hey,
question here.
Katie. Hey,
Yeah,
Katie.
go ahead, Kelly.
I wonder if someone can post the ombudsman in the chat or any other important number, because I've seen quite a few questions around. I got my assessment 7 weeks ago. I've not heard anything. And the LME tells me we're still waiting. Or if I have an issue, where do I go? So if we could just repost the ombudsman or any critical places where people can escalate issues to, I think that would be really helpful. Nothing is perfect, and sometimes the issues will happen. So we just want to make sure folks know where to reach out if an issue does arise.
Yeah, we'll make sure we get that in the chat too. Thank you. All right, I think we had a question, one last question maybe about non-medical transportation. And Kelly, I think you mentioned that earlier. Maybe you want to just touch on that again? How can folks get transportation?
I just put it in the chat again. There's again, remember that accessible communications packet we talked about? There's a flyer on 1959. I posted that earlier. There's a flyer on getting non-emergency medical transportation. So I just posted the flyer. Remember, you can get transportation, Medicaid paid for transportation to whatever Medicaid benefit covered appointment you need. And some people are used to using it and some people have never used it before, but that flyer gives some information about how to set it up and call. And again, this is a good opportunity. Like if you look at the flyer and you're like, well, that answered some of my questions, but not all of them. Go to the QR code, say what other questions you have about an EMT so we can help, because we do want folks to be able to get to their appointments, to have their direct support professional accompany them. Want to make sure they feel like if you happen to use a wheelchair or other adaptive technology that you can still get transportation. We don't want folks to feel inhibited in using transportation to get to, could be a medical appointment, a behavioral health appointment, a physical therapy appointment. If it's covered by Medicaid, you can get transportation to the appointment.
Thank you all so much. Appreciate everyone's time today. And I'm going to turn it back over to Dina.
Thank you, Katie. If we did not get an opportunity to answer your question during the webinar, questions and feedback are always welcome at bhidd.helpcenter@dhhs.nc.gov. The recording and presentation slides for today's webinar will be posted on our community engagement and training webpage. Thank you for attending today's webinar. We look forward to seeing you again and invite you to join us for the next side-by-side webinar hosted by Director Crosby on Monday, August 5th. The registration link is included in the chat box. There will be a brief survey following today's webinar, and we would appreciate your time completing it. This concludes for our webinar for today. Thank you for attending.
Thank you all.